Good afternoon, everyone. It's 2 o'clock and time to start today's briefing. Joining us today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Darren Roush, Health Officer and Director of the Greenfield Health Department, and Nancy Hernandez, President of the Hispanic Collaborative and founder of Abrazo Multicultural Marketing and Communications. County Executive Crowley, you're up first.
Is David muted?
David, are you on mute?
Can you hear me now?
Yes.
Okay. I know we've been doing this for so long, I still haven't figured this out. But thank you, Sydney, so much. I want to start off today on a positive note. Today, the Milwaukee County Board voted to approve an additional $425,000 in CARES funding to support 5 community-based organizations. The recipients of this funding, they were identified by the Community Resilience Response Team. And this team offers community-based guidance to our regional COVID response, but it's also made of individuals with intimate knowledge of Milwaukee's history, but also the impact of the pandemic today. So in total, the Milwaukee County has awarded $850,000 to community organizations based on the recommendations of the Community Resilience Response Team. These funds support the important things local organizations are doing really to keep residents both safe and healthy. So these are supporting like job programs, job training programs, mental health services, and COVID-19 risk mitigation education, as well as awareness. The organizations that are benefiting from these dollars are excluded by other COVID-19 funding opportunities. And they work with essential workers without health supports, childcare, and other necessary services, and serve groups experiencing disparate health impacts, like communities of color, our aging residents, and people with disabilities. So the organizations that will benefit from these dollars are providing services that are invaluable to the health of our community. They continue to aid the county in our effort to bridge the gap in health disparities, which is a key pillar of our strategic plan to achieve racial equity and become the healthiest county in the state of Wisconsin. And also Community Advocates is notifying award recipients and scheduling check pickups times today. That's when that's going to begin. And I'm really proud of the work that they're doing. And I'm proud of the Milwaukee County Board for just voting to help ensure the continuation of essential services. But unfortunately, when it comes down to the continuation of federal pandemic relief funding, particularly for state and local programs, the news definitely isn't as bright. And so last week, as I mentioned, Milwaukee County, we have fully allocated all of our CARES Act funding with millions of dollars going towards life safety measures and emergency operating costs, as well as other programs and new programs. And these funds have supported essential services. And I'll mention them as I've mentioned them before. We are supporting housing stability through eviction and foreclosure prevention programs that have offered rent and mortgage assistance. We're providing relief to small businesses impacted by the pandemic and beginning to address the increased mental health care demands that we're seeing. And I warned of the tough decisions that we'll need to make if we don't receive additional federal relief dollars. So this week is looking like the relief that the state and local governments so sorely need is still hanging in the balance. And so if Congress really fails to include state and local funding in the federal stimulus package, many essential services that we have been providing could cease to exist. And so we could lose federal funding for essential services like our COVID testing programs that have helped to reduce the spread and protect the community, important contact tracing efforts, but also vaccination distribution efforts might be impacted. And it will significantly hamstring our efforts to help small businesses and prevent further long-lasting economic damage. And so, you know, and honestly, that's not all. Our eviction prevention efforts, our mortgage assistance programs are all at risk of running out of money next year. And so just in a couple of minutes, Nancy Hernandez, a president of MMAC Hispanic Collaborative, she's going to talk about the impact of COVID-19 in the Hispanic and Latinx communities. Because without more relief, our most vulnerable populations, again, including communities of color, our senior citizens and people who are differently abled, will suffer disproportionately due to the lack of access to testing, food, employment, shelter. And that all falls under the Milwaukee County umbrella of services. So if you haven't received a test at a public site, made a call to your local department or made a public employee assist with contact tracing efforts, you know how important these programs and services are. And so today I'm really asking for your help. I know that the holidays are coming up. So the best Christmas gift that you can give to anyone, or Kwanzaa gift, or any holiday gift, is by contacting your congressional representative and senator and tell them that we need this funding at the state and local levels. The pandemic has brought many stresses, physical, mental, financial, and many others. So we have to make sure that our voices are being heard. So we make sure that the impacts of the pandemic are minimized in this upcoming year. And I just want to say thank you again for all that you are doing in advance. And with that, I'd like to hand it over to Mayor Barrett and say thank you for your continued partnership.
Thank you very much, County Executive Crowley. And I want to begin by saying that County Executive Crowley is spot on when he is talking about the need for assistance to state and local governments. Over the past 9 months, we have witnessed one of the most, if not the most, cataclysmic events that we have seen in our lifetime. You have to go all the way back to World War II to see the type of death and destruction that we are seeing in the United States right now. And although the federal government has done some things, and Governor Evers has done some things, at the state legislative level and at the congressional level, now is the time for action. As the county executive mentioned, tracing, testing, possibly vaccinations, all that is very, very important. And here in Milwaukee, the testing and the tracing has been done literally on the ground. This is where it's being done. This is the grassroots effort to deal with this pandemic. And our ability to continue the testing, our ability to continue the tracing is going to be severely hampered if we don't have this assistance. But it goes far beyond that. Again, as the county executive said, from mortgage help, eviction help, dealing with small businesses, our local governments have stepped up to help our residents, our businesses, our not-for-profit organizations, because they're all threatened by this pandemic. And there seems to be a visceral reaction against helping a local government and helping state governments from some quarters in Congress. And to me, this is really where we're having a positive impact. And it would be a serious mistake for Congress to adjourn before the holidays without addressing these issues. We all know which way the winds are blowing right now. It appears that the package that's being negotiated drops out any assistance for state or local governments in the forms that we have seen earlier this year. And I think that that's very, very unfortunate. So I want to thank the county executive for speaking out on this. I agree wholeheartedly with the concerns that he has raised. And all you have to do is look at our testing numbers and our testing efforts to see that it's working. Just yesterday, for example, we had 1,159 people who were tested at Miller Park. We had at our 2 City of Milwaukee health centers that are operating as spots for COVID testing. We had 426 people tested at the Northwest Health Center, and we had 251 people tested at the Southside Health Center. So right there, you're going to see basically close to 2,000 people that have been tested in the city of Milwaukee. You add on to that the 311 that were tested in South Milwaukee, because this has been a city-county effort. And you start to see that we are having an impact when it comes to testing. And I think that this has been one of the reasons that we are able to deal with this, not as successfully as we all would like, but we're able to deal with this pandemic in a responsible way. And we can see that. We can see that we are making some progress right now, because we're starting to move away from all reds in our indicators this week. That is very good news. We are now at green for cases, but we should be cautious. The trends are heading in the right direction, but we do have a high level of disease still in the community. We have a red for testing and yellows for care, PPE, and contact tracing. So there's a lot of work that needs to be done, but without this partnership or assistance from the federal government and ultimately the state government, we're not going to be able to do that. So the numbers have been better. We are at a 11.1 positivity rate, which is the lowest percent positive we have seen since October. So in terms of the trend, that's a good trend. But 11.1% positivity rate is nothing to write home about. because we need to continue to drive this rate down. If you look at places like New York, they're looking at rates that are their triggers at 1% and 3% and 5%. And here we're at 11.1 positivity rate. So again, relatively speaking, it's better than we were a month and 2 months ago, but it is not something where anybody should be popping any bottles of champagne because this disease is still far too prevalent in this city. But we continue to do the testing. We're now at about 3,300 tests performed each day, which is what we want to be seeing. We want to see people getting tested because testing is such an important tool to determine the spread of COVID-19. We must remain vigilant in getting tested. If we are displaying any symptoms or have been exposed to someone who has tested positive for COVID-19, especially as we head into the holidays. So if you are demonstrating any symptoms or if you've been exposed to someone who is tested positive, please make sure you get tested as soon as possible. So here we are now, again, 9 months into this, and we are beginning to see the light at the end of the tunnel. But I would say that this light is 3 to 6 months away, probably closer to 6 months away. But we had another briefing this morning with the state. But before I give just a quick update, again, I want to remind everyone that the arrival of the vaccine in our state is such an exciting development, but it is really just the beginning of this long process. We need everyone to stay loyal to the good practices of the last several months that include washing your hands, watching your distance, and staying home if you are sick. One of the things that I learned this morning is, at least as it relates to the Pfizer vaccination, that what that does is it prevents you from getting it. What we don't know at this stage, and I think the testing is continuing, is that if you get the vaccination, the Pfizer vaccination, does it prevent you from spreading the disease? I don't know that answer. I don't know that the scientists know that answer. That's something that they're still testing. So if you get the vaccination, and not that many people have gotten thus far, and I'm talking about the Pfizer vaccination, it is unclear at this point as to whether that would stop you from spreading. What does that mean? To cut to the chase, it means even if you get the vaccination, keep wearing that mask. Now, the next question that is going to come up, of course, is the allocation decisions. And allocation decisions are being based on who has made it through the vaccination process and in terms of local entities that are going to be doing the allocating. And that is a federal system that's extremely detailed. So we're going to have hospital systems, we're going to have FQHCs, we are going to have Walgreens and CVS that will be dealing with our long-term care facilities over the next 3 or 4 weeks. So that's starting to gel. But again, we have a long way to go. So we also know that this is not perfect. Based on a circumstance in the UK where an individual had a serious reaction, sites that are being selected now need to be prepared to address a serious allergic reaction. This is good medicine, it's common sense. If we have organizations that are giving out the vaccination, we want to make sure that we have safeguards there in the event, the unlikely event, but in the event that something is could go wrong. But because of this concern, the decision was made by the state to only vaccinate at healthcare settings right now. Again, this is very fluid in our conversations at the local level and at the state level. This is changing sometimes on a daily basis. And I'm not critical of anybody over this because you have to put this in perspective. What we have done in this country, what we've done in the world is develop this vaccination in less than a year. Oftentimes, and the doctors and the scientists can tell you this, it's a many year process for research, for testing, for approval. All of that, which is what has led to this emergency use approval, has occurred in a very truncated period. But we have been told, and I believe, that all those safeguards are still in place. And so now the state has set up this hub distribution for the Pfizer, and they've selected 8 hubs in the state to receive the vaccine. And those hubs have the ability, through their spokes, as they're describing them, to transfer to sites that are administering the vaccines. It's likely that now that Pfizer is up and running and coming in, and will come in more, that Moderna, I think we all recognize, is the next one. The FDA is meeting today, and we're hoping that approval will come today or tomorrow. And so it's likely the state will receive the Moderna vaccine early next week. Again, healthcare settings administering the vaccinations are following the guidance issued by the state, which is following the guidance issued by the CDC. So there's a lot of steps in this. And we know in the coming weeks, the state will provide data as it relates to who is receiving the vaccine. And that's a concern that I have, that we have here at the city, that there's an equitable distribution of this. So there is a lot going on. Some of it is good, some of it is challenging, some is still very, very sobering, but you can see people are committed to addressing this in a very serious way. And so with that, I'm going to turn over to Dr. Weston, who as always provides a lot of great information for us. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we have had 79,114 confirmed cases of COVID-19 in our community and 799 individuals who have died in our county. When we look at disease burden in Milwaukee County, we are seeing promising trends. We're seeing our cases and our positivity rates in a sustained downtrend. Our hospitalization numbers are stabilizing, as are our death rates, though they do remain quite high. And to be sure, each of these items are higher than they were earlier in the pandemic. But we're thankful to not be experiencing the frankly unsustainable increases that we were just several weeks ago. Locally, regionally, and nationally, COVID has been a story of ups and downs with a cyclical pattern of the disease burden. As that disease burden rises, precautions strengthen, with both institutions tightening rules and orders, and individuals taking more precautions. And this is what we've experienced recently. And now we're being rewarded with these improved trends. But as we've seen in the past, these more promising numbers then lead to the opposite. It leads to institutions loosening restrictions and individuals venturing back out, letting down their guard, and a resultant increase in disease burden. And so this is what we must work so hard to avoid this winter. We have to continue our vigilance and our precautions, especially now with a vaccine in sight. And once we're able to see widespread vaccination, we can break that cycle of disease and see true sustained downtrends, coupled with a return to more normal behavior. On the vaccine front, I wanted to touch briefly on vaccine prioritization. I hear from people of all walks of life every day, when will I receive the vaccine? And the answer in all cases is frankly soon, but perhaps a bit sooner for some groups than others. At a national and a state level, specific groups have been designated to receive the vaccine in a defined order. So the first group to receive the vaccine is what is referred to as phase 1A, and this is our frontline healthcare personnel and those in long-term care facilities. So we've already seen our hospital systems receiving vaccine and beginning to vaccinate their frontline providers. And we'll soon see this expand much more broadly to other frontline healthcare personnel in the outpatient clinic settings, as well as our EMTs and paramedics working so hard day in and day out on the front lines in our EMS systems. Additionally, both the staff and residents of long-term care facilities will be receiving the vaccination in the coming weeks. And after that comes phases 1B and phases 1C. And these groups are still being considered and will be fleshed out at the national level in the coming week or two. It's expected that these groups would comprise a few different categorizations. One is essential workers. Our essential workers who have kept our kitchens stocked, our transportation running, our children educated, and our communities safe and functioning over this last year. So this includes those in food and agriculture, the transportation industry, education, energy, law enforcement, manufacturing, and other essential services. In addition to them, those with high-risk medical conditions and those in more advanced age groups will certainly be considered in that 1B and 1C group. So more to come on that in the near future. And as for the timing of each of these groups, it's hard to say definitively. Given the scope of the manufacturing and the logistics of distribution of the vaccine, it's not unlikely that timing targets may fluctuate a bit. So that said, it seems likely that each of these groups should likely be offered vaccine between now and the spring, with some overlap in phase 1A and 1B, probably midwinter, and then 1B to 1C overlapping toward the beginning of spring. And that would be followed by vaccine availability for the rest of the population more generally. Transitioning to a more personal note, it's been heartening and inspiring to see the rollout of the vaccine start in our county, in our state, and across the country among many of my healthcare colleagues and friends who have frankly been so strained and stressed over the last 9 months. I think we're truly witnessing the beginning of the end of this pandemic. So I'll stop there. Thank you very much. Stay safe, and I will hand it to Director Rausch.
Thank you very much, Dr. Weston. It's my pleasure to join this afternoon to give a quick data update from the Epidemiology Intelligence Team. I'll start today, like I've started other previous weeks, talking about a few of the overarching themes that we're going to see in the data today. As others have mentioned, there does appear to be a general downward trend, but more recently within the last week, I would say that it was a slight increase to steady trend in COVID cases countywide compared to the prior week. And you'll see what I mean more closely when we pull up the data in a moment. The data did have a blip within the last week, and we know that the data lag, that is the time it takes to get a completed lab result back, does hinder our ability to look at the trends more specifically and more detailed. This trend, the downward but yet steady trend, also continues not only in the whole population, but also in our children as well. Another note that I'll make when we look at the data is that the trends in COVID-19 deaths are alarming, and this is a trend that began in late October and really continues to present day. As we've talked before, deaths are a lagging indicator, but we are seeing daily reported deaths countywide at levels comparable to what we saw in April and May. The 7-day average death reports are significantly higher in the suburban communities than at any other time over the past 10 months of this pandemic. And while the 7-day average deaths for the city of Milwaukee are higher than we had experienced since spring, they have trended up more recently and should be a concern. Lastly, I just want to continue to emphasize that we still need to continue to use all of the COVID-19 prevention strategies at our disposal. Masks, distanced, gatherings to household members only. This is not the time to relax, as we've said before. We must continue to be vigilant about driving down disease transmission rates. So with that, I'm going to go ahead and pull up the data and just give you a sense of what is going on looking at our population data. So this data report is for the most recent week. And again, we do reflect the most recent week's data as preliminary because it's still incomplete at this point. And this is the little spike that I had mentioned within the last week. We see it as a little blip and a downward trend. So overall, there's a lot of things that we can look at this to be positive and be optimistic, but yet keep in mind that we are still at rates higher than we were in the months of August and September when we were at some of our lowest marks. The death data reflects here. Again, I will point out that we are seeing some daily counts on certain days of 10 deaths reported on that particular day. Our highest, I will note, in April was 12 deaths in a day. And we see the 7-day trend very, very high for the suburban communities. And again, we see a similar peak here in the city of Milwaukee, but that peak pales in comparison to what we saw in spring. So we need to continue to do the things we need to do to drive down disease, to really prevent those in our most vulnerable populations from becoming very sick and passing away from COVID. We'll talk next about reproductive number. This is something we've talked about, the transmission rate. We've seen that it goes up and down over time, and we're really cognizant of that line of 1 because a number of 1 means that for every positive COVID case, 1 additional person becomes ill with COVID themselves. And we have seen right after the holiday, the Thanksgiving holiday, a spike above 1, and now we're driving that back down. And that trend is seen both within the city of Milwaukee and the suburban communities as we see here. So we're seeing a very similar shape to this transmission curve. And again, that number below 1 means we're suppressing disease. All of the demographic trends remain the same as previous weeks. And certainly I wanted to kind of just highlight testing because that has been something that's been on our mind for the last several weeks. We did see in the weeks leading up to Thanksgiving a lot of tests, about 45,000 tests in Milwaukee County for that 3-week period each week. And then we saw a marked decrease of about 30% decrease in testing, an increase last week, and then data still pending for the most recent week, but hopefully that's going up. The point here, folks, is that there is testing available. If you need a test, if you've had an exposure, if you want to test, please get a test. We are seeing some positives in the 14-day trend. It does look to be trending down, but I'm always very cautious because the data for the last week is still incomplete. And so where this percent positivity number is looking now may look different when we get that data in more completely. I'll end here just looking at the areas of the county where we've had cases over the last 2 weeks, looking from December 2nd through the 15th. Again, the red areas are where we have more disease across the county, and we are seeing a wide dispersion of cases throughout the county. Red, orange are some of the higher points. And so even though disease is low, we still have pockets of high disease activity. To conclude today, I just wanted to make a few remarks about COVID vaccinations. Now that COVID vaccine is starting to become available, and with that focus on critical infrastructure, we know that things are going to change in the coming weeks. Dr. Weston did a great job of talking about priority groups and really working to assure everybody that vaccine will become available. We just need to be a little bit patient and wait for your turn for vaccination. Importantly, the rollout of vaccination does not end the important work of public health, however. In addition now to disease investigation and contact tracing, the recent days and weeks have begun and continued vaccination planning efforts to assure the delivery of vaccine in our communities. Future months will likely have public health departments coordinating and leading community clinics. With the expansion of our focus to include vaccination is an important need for continued state and federal funding to continue our important work, including the expansion of efforts into vaccination. In conclusion today, and since this is my last media briefing of the year, I want to wish everybody a safe and happy holiday season. Please continue to keep your gatherings small and wear your masks to limit spread of COVID-19. We know ultimately, like so many holidays before this season will be different than others in the past, but we can continue to celebrate in new and different ways with friends and family, knowing that there is a light, and 2021 may bring close-knit family gatherings and Christmases and Hanukkahs and Kwanzas of old. So thank you very much for your time and attention. I'll now turn the briefing over to Nancy Hernandez, President of the MMAC Hispanic Collaborative.
Thank you so much, Darren, and thank you for having us here today to share in this important message. The Hispanic Collaborative is a community-driven effort to move Milwaukee into a top 10 city against 50 peer cities on the Hispanic Wellbeing Index. We have all heard the statistics. Because of a variety of issues, the Hispanic community has been severely impacted by COVID-19. We at the Collaborative have kept a close eye on this, and in fact have had researchers in the community since September to quantify the local economic impact on households and businesses. Among some of the key statistics that we have seen that have become more severe since September include 33% of our households have identified skipping rent or mortgage payments, putting them at risk for evictions and foreclosures. 50% of households are citing having difficulty keeping up with their household finances, which include important pieces such as food and medicine. On the business side, 75% of our businesses are at higher risk for failure, having to have operated under limited hours or services, or having gone through a period of business closure, affecting their sales and livelihood. And 62% of our Latino-owned businesses are only at half of their pre-COVID sales levels today or less. There's continued need for programs, technical assistance, and direct assistance for families and businesses, especially in our Latino community. We have seen and continue to see that the need far outweighs the financial resources right now, putting us all in a potentially devastating outcome for our families, economic corridors, and overall future prosperity. We are very grateful for the recent support from the County Executive Crowley and the CRRT for their $50,000 investment that our community partners have safely gotten into the hands of needy families in a matter of days. We are also very grateful for the investments that have been done at the state level and our philanthropic communities here in Milwaukee. But the Hispanic Collaborative joins the call for additional federal funding to support community needs and applauds the role that state and local government entities can play to bring the understanding at the community level that is needed in order to truly help community. Thank you so much for having me here, and Feliz Fiestas, Milwaukee.
Thank you very much. Our first question comes from Patrick Palantonio at WISN 12 for Dr. Weston. Right now, healthcare systems are only vaccinating a few people in these first days of receiving the vaccine. For example, the VA received 2,000 plus doses and only gave the vaccine to 5 people. Why the slow rollout?
Yeah, it's a question I don't have a great answer to. You'd have to ask the specific health systems. I know there's a lot of logistics involved in rolling out the vaccine, but I think we've seen quite a few people vaccinated, and we'll see many, many more in the coming days.
Our next question is from Sean Kirkby at Wisconsin Health News for Director Rausch. How are contact tracing efforts going? Are health departments still in crisis mode, or has that changed due to the falling case counts?
Yeah, that's a great question. I can speak specifically to my health department, then I'll generalize a little bit more broadly. The contact tracing indicator still remains red on the countywide dashboard. So even though the numbers have gone down, I know in my health department, we're still receiving somewhere between 25 and 30 COVID positive cases each and every day. And that is a number that continues to have us in crisis standards and continue to prioritize case follow-up. Looking generalizably across the county, that is a similar trend in other departments. The numbers that are coming in are still at the level that require crisis standards. However, we are a little bit more successful in getting to those cases in a more timely fashion because the numbers have been down slightly.
We have a series of questions from Sharon Bajenda at CBS 58. The first is for Dr. Weston and Mayor Barrett. On Tuesday, Commissioner Jackson said there are daily meetings about vaccine distribution. One of the topics of discussion is the definition of essential worker. How is that discussion going, and how do area officials pick out which profession is considered essential following healthcare workers?
So I can start off on that one. So there are 2 agencies that help to make these determinations. So one is at a national level, and that's the ACIP, the Advisory Committee on Immunization Practices. And then at the state level, there's the SDMAC, which is the State Disaster Advisory Committee. So each of those committees takes into account equity-related issues, disease burden-related issues, and will determine how to define those subgroups. So more on that will certainly come in the next 1 to 2 weeks.
And I'll just add in, this is all being done in real time. This is something that's happening at the federal, at the state level, and we will get our guidance from both the federal government, which gives it to the state, and the state that gives it to us locally through the committee that Dr. Weston referred to.
The next question from Sharon Bajenda at CBS 58 is for Dr. Weston. Could someone test positive for antibodies after only the first dose of the COVID-19 vaccine? If so, are they fully protected yet, even though they tested positive?
Yeah, so good question. The way the vaccine works is it does provide you with antibodies. So after the first dose, you have some level of protection, but it's not nearly as strong as the protection you have after the second dose of vaccine. So it is plausible that you may test positive for antibodies after the first dose. That doesn't necessarily mean you're fully protected. You'd want to follow through with the full course of the vaccine and get the second course as well.
The next question is from Sari Lusk at the Milwaukee Business Journal. For the medical professionals, to what do you attribute the local improvement in the indicators? Dr. John Raymond at the Medical College of Wisconsin said it could not be attributed to a decrease in testing because hospitalizations and deaths remain at high levels. Do you agree?
I would agree with that. Yeah. So there have been times when we see testing and cases going in the same direction, and testing is really driving the cases. Now, I think what he's outlining there, which is absolutely correct, is testing does not drive hospitalizations. Testing does not drive deaths. And we're still seeing high numbers of those. Now, we are seeing real trends, real downtrends in our percent positivity, which is fairly independent of testing. We're also seeing real trends in our hospitalizations. Our deaths have not seen the downtrend quite yet. Now, that is what we call a lagging variable. It takes some time to catch up because we know cases come first, and then a few weeks later, hospitalizations, and then sometime later, deaths. We would hope and expect that we'll start to see a decrease in deaths in the next 1 to 2 weeks. So we'll certainly keep an eye on that. But I think a lot of the trends that we're seeing are real. Whether they'll be sustained really depends on the individual behaviors that we see moving into the next weeks to months.
Next question, also from Sari Lesk. Where does vaccine distribution stand in the Milwaukee area? Which healthcare providers started vaccinating, and how many people locally have been vaccinated?
Again, those they're
ahead,
very low. The numbers are very, very low right now. Go ahead, Dr. Weston.
No, I was just going to say the same thing. The numbers are low. I think they're ramping up quickly. Each health system will be able to comment on, how much vaccine they've received, what their processes are for rolling it out. But I think we'll see a pretty rapid ramp up in the next few days.
And I would concur. This is an issue of days, not weeks or months. This is going to happen in the next few days. That's my understanding as it comes in. When the Moderna supply comes in, the Pfizer stuff is continuing to come in. And so the Pfizer uses this hub model, and then from there it has spokes. Moderna will have some more direct distribution to those who can receive it. So I anticipate this to happen very quickly before Christmas.
Our next question is from Ben Wagner at WISN 12 for Mayor Barrett and County Executive Crowley. On federal COVID relief funding, is there a specific resource you're most concerned about losing if a deal isn't passed before the holidays?
I can speak on the city behalf. There's actually 3 that I'm concerned about right off the top. First and foremost, of course, is our health department. Our health department has used literally millions of dollars in support for all the work that has been done. This is money that goes directly to serving residents who are being tested, who are being traced. That's very, very important. Second, I am extremely concerned, as I know the county executive is, about a housing crisis that could begin as soon as December 31st, when the moratorium ends. I am hopeful that whatever package is passed will have a continuation of that moratorium on evictions. I think that's very, very important. But I've talked to both advocates for tenants as well as representatives of landlords, and they both groups have told me there is reason to be concerned here. There could be a horrible situation in housing, not just in Milwaukee, but in this nation, if we don't have that assistance at the local level. Finally, small businesses. I'm very concerned about the small businesses in all parts of this community. And those are all places where we have put resources. And I don't think anybody expects, whether it's the tenants, whether it's people who own homes, who have lost their jobs, whether it's small businesses, to come out of this unscathed right now. So there's a lot of concern at the local level. At least,
and I wholeheartedly agree with Mayor Barrett. When you think about what Milwaukee County has done, again, 1/3 of our CARES allocations have went to community support programs, to support businesses, support people to stay within their homes. We know that there is a crisis waiting for us in the new year if we do not receive the resources to provide those critical services. But also, when you think about what we have to do, we still have to provide those housing services for our homeless population, provide critical services around mental health. It's hard to pinpoint one or a few things when we know in totality, when we look at this, we need all the resources that we can to make sure that we're staying ahead of this pandemic and responding accordingly.
Our next question is from Patrick Palantonio at WISN 12. Mayor Barrett, since the city increased the fines for restaurants and bars in violation of COVID rules, have you seen a decline in citations? Do you know how many have been handed out?
I believe we have seen it. I have to get those figures exactly, but I believe that the number of citations has dropped. I would have to check that to give you the most accurate answer I can. So we'll get back to you, Patrick, on that.
It looks like we're coming up on one of the final questions. A reminder, if you do have any questions for our panel, please place them into the chat. The next question comes from Ben Wagner at WISN. On the COVID vaccine, just lost the question. Has there been any discussion about how the vaccine will be distributed in Milwaukee County once it's widely available?
Yeah, I'll start with that one. On the public health side, we've been planning for mass vaccination efforts for almost 20 years, really since the advent of public health preparedness in the early part of the 2000s. We do know that vaccine will become available widely to health departments, to other community vaccinators, and we have had many conversations about trying to coordinate those in a way to be very strategic so that as many people in the community can get vaccinated as quickly and efficiently as possible.
Our next question is from Patrick Palantonio at WISN 12 for the medical professionals. Can you explain the follow-up from the medical field to make sure a person returns at the appropriate time to get their second dose of the COVID vaccine within the appropriate time frame?
Sure. So right now the vaccine rollout is with that 1A group, which is a pretty contained population, somebody who works for a healthcare system, somebody who works or lives in a long-term care facility or for an EMS system. So in those cases, obviously, it's somewhat easier to keep track of people, send out notifications when it's time to get the vaccine. It'll obviously be a much greater challenge once this becomes a vaccine widely available, but there's work groups working through the logistics of how best to ensure those communication systems are in place.
The next question is from Ashley Sears at Fox 6, piggybacking off the previous question. Would the community vaccination effort look more like testing seen at Miller Park, or would it take place in a clinic setting?
I really think it could look a lot like Miller Park in terms of drive-through testing, certainly as the weather starts to cooperate a little bit more in Wisconsin. But it also could exist in a clinic setting. So I think most appropriately, there'll be a combination of options, and widespread community vaccinations may be a drive-through like the Miller Park testing site or something similar. But yet I also believe that healthcare providers may have doses, towards late spring, summer, that would be available in a clinical setting as well.
Our next question is from Allison Durr at the Milwaukee Journal Sentinel. Is there a commitment from Miller Park to continue testing or any other COVID efforts at that location in 2021?
I don't know that off the top of my head, but I'll tell you that the Brewers and Miller Park have been phenomenal in working with. They just have been great partners through all of this. And so I think if they can help, they will. I think they're most interested in playing baseball there, and I certainly agree with that. So assuming that we can still do it, I think they'll be with us. But again, if they can play baseball, they want to play baseball there, and I understand that. We all want them to play baseball there.
That appears to be our final question for the media, from the media. Media, last call for questions. All right, thank you everyone for joining us today. We'll be back here again on Tuesday.
Thank you all.
Thanks, everyone.
Thank you.